Are you experiencing symptoms that's causing you to worry? Are you seeing blood in your stool, excessive bloating, unintentional weight loss, or always tired? Colon cancer, also known as colorectal cancer, can often be asymptomatic in its early stages, meaning although the disease is present, you may not show any symptoms, making it even more crucial to be aware of the subtle signs that may indicate its presence even if you are fit, active, and healthy. Welcome back to Glow Up Facts. In this video, we are going to discuss 10 hidden signs of colon cancer with explanations and relevant statistics. By the end of this video, you will learn to recognize the hidden sneaky signs that may end up saving your life or the life of someone you love if caught early. Let's dive right in. Let's start with the big question, because knowledge is power. What is colon cancer? Colon cancer, also known as colorectal cancer, is a type of cancer that originates in the colon, the large intestine, or rectum, the lower end of the digestive tract. It occurs when cells in the lining of the colon or rectum undergo changes that cause them to grow uncontrollably, leading to the formation of tumors. Colorectal cancer typically starts as small, benign growths called polyps, which can develop on the inner lining of the colon or rectum. Over time, some of these polyps can become cancerous. There are different types of colorectal cancer, but the most common type is adenocarcinoma, which arises from the granular cells of the colon lining. Risk factors. Several factors can increase the risk of developing colon cancer, including age. Most cases occur in people over 50. Family history of colorectal cancer or polyps. Personal history of inflammatory bowel disease such as Crohn's disease or ulcerative colitis. Certain genetic syndromes, example, Lynch syndrome. Familial adenomatous polyposis. Lifestyle factors such as diet high in red or processed meats, low physical activity, obesity, smoking, and heavy alcohol consumption. Symptoms. Common symptoms of colon cancer may include changes in bowel habits such as diarrhea or constipation, blood in the stool or rectal bleeding, unexplained weight loss, abdominal discomfort or cramping, and a feeling of incomplete bowel evacuation. Don't worry, we'll look at each of these signs more closely in this video. Diagnosis and treatment. Diagnosis typically involves a combination of medical history, physical examination, laboratory tests, imaging studies like CT scans, and colonoscopy to directly visualize the colon and obtain biopsies. Treatment options may vary based on the stage of cancer and can include surgery to remove the tumor, chemotherapy, radiation therapy, targeted therapies for specific genetic mutations. Prevention. Preventative measures include regular screening starting at age 40 or earlier based on risk factors, maintaining a healthy diet, exercising regularly, avoiding smoking, and limiting alcohol consumption. Now, let's look at these signs a little more closely to help you detect suspicious symptoms right away. Number 1. Changes in bowel habits. Sudden changes in bowel habits such as diarrhea, constipation, or alternating between the two frequently can be indicators of colon cancer. This may occur alongside a noticeable change in the consistency or shape of stools, such as long pencil-thin stools. According to the American Cancer Society, persistent changes in bowel habit can be a sign of colorectal cancer, particularly if they last for more than a few days. Number 2. Unexplained weight loss. Individuals may experience unexplained weight loss as their body struggles to cope with the cancer, affecting metabolism and appetite. This can occur even if there are no dietary changes. The American Society of Clinical Oncology notes that about 15% of patients might experience significant weight loss as an early warning sign. Number 3. Blood in stool. The appearance of bright red or very dark blood in the stool can indicate that there is bleeding within the colon, a potential sign of colon cancer. It's important to note that this can also stem from non-cancerous sources. A good way to test this is to place a sample of your bloody stool in a sterile urine cup and take it to the emergency department at your local hospital right away so they can begin testing. A study published in the Journal of Gastroenterology found that approximately 40% of patients with colorectal cancer reported rectal bleeding. Number 4. Persistent abdominal discomfort. This includes persistent cramps, gas, or pain, which are often dismissed as everyday issues. An increase in discomfort can signify underlying issues, including tumors in the colon. It's best not to assume these are always signs of IBS, but to get real answers. According to the National Cancer Institute, about 70% of patients experience abdominal discomfort as one of the initial symptoms. Number 5. Narrowing of the stool. A noticeable change in the shape of your stool may manifest as narrower stools. This can signify that there is something obstructing the colon, such as a tumor. The American Gastroenterological Association states that changes in stool shape can warrant investigation when accompanied by other signs. Number 6. Fatigue. Fatigue that doesn't improve with rest can be a subtle sign of colon cancer. This may arise from anemia due to chronic blood loss or the body's energy being diverted to fight the cancer. The National Cancer Institute indicates that about 60% of colorectal cancer patients report experiencing fatigue. Number 7. Anemia. Chronic low red blood count can result from cancers that cause internal bleeding. Patients may notice symptoms like weakness or paleness. An estimated 25% to 50% of patients with colon cancer may present symptoms of anemia, according to the American Cancer Society. Number 8. Feeling that your bowel doesn't empty completely. A sensation of incomplete bowel evacuation after a bowel movement may indicate a physical obstruction or mass in the rectum or sigmoid colon. Research in the Journal of Clinical Oncology suggests that this sensation is reported in around 30% of patients at the time of their diagnosis. Number 9. Bloating or fullness. Chronic bloating or a feeling of fullness can be a symptom of colon cancer, particularly if persistent. It may be due to gas accumulation or a tumor obstructing the bowel. Studies show that 50% of patients may report bloating as a key symptom prior to diagnosis, according to the American College of Gastroenterology. Number 10. Unexplained changes in appetite. A sudden decrease in appetite is often overlooked, but it can be tied to the body's response to cancer. Patients may find they do not feel like eating even if they haven't changed their meal patterns. The American Cancer Society reports that about 20% of patients with colon cancer experience significant changes in appetite. Here are some general statistics and information regarding colon cancer worldwide. Colon cancer, also known as colorectal cancer, is one of the most commonly diagnosed cancers globally. According to the Global Cancer Observatory, there were approximately 1.9 million new cases of colorectal cancer in 2020, making it the third most common cancer overall. Mortality. Colon cancer is also a leading cause of cancer-related deaths. In 2020, 935,000 deaths attributed to colorectal cancer, ranking it as the second leading cause of cancer mortality worldwide after lung cancer. Geographic variation. The incidence of colon cancer varies significantly by region. It is more prevalent in high-income countries compared to low- and middle-income countries. Factors contributing to this disparity include lifestyle factors, dietary habits, screening practices, and access to healthcare. Risk factors. Common risk factors for colon cancer include age. Most cases occur in people over 50. Family history of the disease, certain genetic conditions like Lynch syndrome, lifestyle factors such as diet, physical inactivity, obesity, smoking, and alcohol consumption, and inflammatory bowel diseases like Crohn's disease and ulcerative colitis. Screening and prevention. Regular screening is crucial for early detection and improved outcomes. Screening methods include sigmoidoscopy and stool-based tests. Recommendations for screening generally start at age 40, but individuals with higher risk may need to begin earlier. Treatment. Treatment for colon cancer typically involves surgery, chemotherapy, radiation therapy, and targeted therapies depending on the stage of the cancer and the patient's overall health. Survival rates. The survival rates for colon cancer vary by stage at diagnosis. The 5-year relative survival rate for localized colon cancer is over 90%, while it drops significantly for metastasis. Early detection through regular screening plays a critical role in improving survival rates. For the most updated and region-specific statistics, consulting resources such as the World Health Organization, the American Cancer Society, or the Global Cancer Observatory would be beneficial, as these entities regularly update their statistics and guidelines related to cancer. And there you have it. Being aware of these hidden signs is crucial for early detection for colon cancer. Regular screenings, colonoscopy procedures, and consultations with healthcare providers can help catch the disease early when it is most treatable. Remember to always advocate for yourself. If you or someone you know is experiencing multiple symptoms or even just one symptom that's persistent, it is advisable to seek medical advice. Colorectal cancer is also a leading cause of cancer-related death. The 5-year survival rate is around 68% for colorectal cancer, which can improve if caught early. We hope you found this health video informative. Share this video with your family and friends, and don't forget to hit that subscribe button for more informative health videos.